and a total of 1,400,247 vaccine doses administered in Clark County. To date, approximately 47% of our eligible population in Clark County, which means folks 16 years of age and older, have received at least one dose of the vaccine. Now, once 60% of that population has received at least one dose of the vaccine, then social distancing and capacity restrictions will be removed. While this mitigation measure uses the administration of one dose as its benchmark, we cannot lose sight of the importance of everyone who is eligible getting fully vaccinated to ensure their health is fully protected, as well as the health of the community, residents, and our visitors. In Clark County, the estimated proportion of people completing the two-dose series of the vaccine is 84.3%. This proportion accounts for the required intervals between the vaccines, which is 21 days for the Pfizer vaccine and 28 days, for the Moderna vaccine. At this time, we estimate that 99,000 people who are eligible for the second dose in Clark County have not yet received it. It's important for people to get their second dose within the recommended time frame, and we strongly encourage that. The first dose of the vaccine, of course, starts building protection from the virus that causes COVID-19, whereas the second dose is needed to get the most protection the vaccine has to offer. And of course, this applies only to the Pfizer and Moderna vaccine, as those are two-dose vaccines. It does not apply to the Johnson & Johnson vaccine, of course, which is only a single-dose vaccine. In regards to the Johnson & Johnson vaccine, we've resumed using that vaccine this week following recommendations of the CDC and FDA. The recommended pause allowed the agencies to thoroughly review the reports of rare but severe cases of blood clots in women who had received the vaccine, as well as to provide information to healthcare providers and public health agencies. Now, after a review of the scientific and case data, both the CDC and FDA recommended that providers resume the use of this vaccine and determined that the potential benefits outweigh its known and potential risk. We continue to work with our healthcare partners and the public to provide information about this vaccine and the potential side effects, and to answer any questions that they may have. The side effects, it's very important to note that the side effects that were investigated were very rare, but we want to make sure that people are aware of them. Now, if people who receive their Janssen vaccine develop severe headache, abdominal pain, leg pain, or shortness of breath within 3 weeks of receiving that vaccine, they should immediately contact their physician or other healthcare provider. Now, beginning May 3rd, the COVID-19 vaccine services offered here at our 280 South Decatur location will move to the building that once housed our non-congregate shelter, which is on the south side of our main building. This will allow our immunization clinic to resume normal operations, including back-to-school immunizations, as parents and children get ready for the start of the new school year and in-person instruction. Additional outreach clinics are posted on our website, which is www.snhd.info/COVID/vaccine. We will now open it up to questions.
As mentioned before, to ask a question, just use the raise hand feature. Our first question today comes from Michael Scott Davidson. Unmuting you now, sir.
Hi, good afternoon. Thanks for taking my question. We talked about the 99,000 people in Clark County who are eligible for a second dose but have not received it yet. I just wanted to clarify, are those people, how behind schedule are they? Is it like the state says 4 days behind schedule and they fall into that category? Or are they all, now they're 6 weeks out from their first dose and they're kind of outside that CDC's outer, recommendation? I'm just wondering how behind schedule they are, and do we have a count of how many people are, waited longer than 6 weeks for their second dose so far?
Joanne, do you have those numbers?
Actually, no, I don't. The 99,000, my understanding is that those included those beyond the third or the fourth week. So, but if you're looking for the ones that are 42 days beyond, we would have to get those numbers for you.
We received a couple of questions in the chat box asking us to please reconfirm the number of vaccines initiated and completed to date. Thank you.
Yeah, this is Dr. Loaf again. I can restate those numbers. So the number of doses of vaccine that have been initiated are 856,131. There have been 596,891 doses that have been completed. That means that that includes a combination of folks who received either one dose of the Johnson & Johnson vaccine or 2 doses of either the Pfizer or Moderna vaccine. And then lastly, there's been a total of 1,400,247 total doses that have been administered.
Our next question is from Jacqueline Schultz.
Hi, good afternoon, everyone. If going on the lack of that certain number of people not getting their second dose, could you explain to the public what the ramifications are of not getting your second dose? And then are you all looking into what the barriers could be? Are people just saying, I'm good with the one shot, that'll be enough for me? Or is there really a challenge with time off and preparing for maybe feeling sick for a day or two, and employers not getting enough, being flexible enough to allow for if someone feels kind of cruddy for a couple days? Are we looking into the reasoning and how to help people? Because it's not appointments. So what could it be?
Joanne, if you like, I can take that first part of the question. Okay. So with both the Pfizer and Moderna vaccine, in the clinical trials, they use 2 doses of both vaccines to study the effectiveness and safety of those 2 particular vaccines. And that's all the data we have right now that determines how effective both of these 2 vaccines are. And with that, we need to continue to push that people get both doses of both of those vaccines, because that's the data that we know, that's the number of doses that we know supports the effectiveness of these 2 doses. Now, which is why we need to continue to urge and encourage people to get that second dose of Pfizer and Moderna if they haven't gotten that dose yet.
Thanks. Yeah, I mean, people need to complete their doses, and they need to finish the series to get that maximum protection, which is around really, really good at 90 to 95%, somewhere in there. So for reasons why, I mean, many have different reasons why they are not getting that second dose. We have some data that may indicate side effects that they experienced, even if they're not really related to the vaccine but occurred at the same time. They may be less likely to get the second dose. And like you said, you know, some people do have challenges with work and with getting to sites. Now that things are busier, children are back to school, we're out more, things are getting more socially, we're seeing more people. So there may not be that prioritization to get that second dose as much as when it was how many months ago. So we're working at some of the reasons. There are some surveys going out. The US Census Bureau had some nice data that looked at why people are not getting the vaccine. And so we're looking at all of those vaccine hesitancy reasons and trying to remove the barriers one by one. For example, we have evening hours now. We have hours on Saturday. Texas Station will be doing a drive-through May 11th, so that if you do have a family with you, they can come along and we can a little bit more convenient. And then those with mobility issues, again, with the drive-through, that might be an option. So there's a lot of opportunity to get the vaccine. One of the things that we said early on in the campaign is wherever you get your vaccine, you have to go back, right? Now that we have a lot of vaccine available, we're saying as our policy right now at Cashman, but then Convention Center next week, is that just come in if you need a second dose. We can get you that second dose no matter where you got it, okay? And we have both available. We have Pfizer and Moderna available. It's just important to get that second dose. And sometimes people, been reading, people are frustrated when they go to get their second dose and maybe the pharmacy or whoever provider has a different type of brand. So it is important to get the same brand, but we have both here in Clark County, and we're ready for you. We've got lots of appointments open.
Thank you, Joanne. From the chat box, we have a question from Chris Cesares asking, yesterday, the CDC announced new guidelines and mask recommendations. What does this mean for Nevada and our current situation with vaccine numbers?
Yeah, this is Dr. Lope again. I can attempt to answer that question. I think those are two separate issues, of course. The change in guidance related to mask recommendations, of course, apply to those folks who are fully vaccinated and apply only in outdoor locations, not indoor locations. And I think that's probably the only thing I can say about that.
Right, and for our vaccine clinics, all of the waiting is indoors. So we would still ask for people to do masks at our clinics because they're not vaccinated, so.
Also in the chat box, we have a question from Rhonda Prast. She's asking, if we see a large number of people not getting their second doses, is that going to affect whether we reopen fully with 60% of people needing to be vaccinated?
Yeah, this is Dr. Lope again. I can take that question. The 60% applies, the 60% threshold is for initiating the vaccination. So either one shot of either Moderna or Pfizer or the one dose of the Johnson & Johnson. It's not required that people be fully vaccinated to meet that 60% threshold.
But, I mean, certainly if we we're a tourist destination, and if it is known that we are really fully vaccinated in this community, that this community is a vaccinated community, that is going to encourage visitors to come here and to enjoy our hospitality and help our economy. So I would say getting a large amount of people vaccinated in this community is really important for us to sustain our economy.
Thank you both. Right now, I'm not seeing any other raised hands or any other questions in the chat box. If you have any questions, we've got a few more minutes. Oh, here we go. Michael Davison.
Yeah, sorry. I just wanted to follow up on that last one. And we are aware that the threshold is for people initiating the vaccination. I would think, though, that our hope and the intention of that was that people, once they start the vaccination process, though, would complete it as planned. I'm just wondering, as a follow-up to that, are there any discussions right now going on that if we see a large number of people that have initiated the vaccine process but just aren't completing it and are more than 6 weeks out? I mean, are there any conversations that are happening or that we believe would happen if we hit that 60% threshold, but it turns out a quarter or a third of those people just simply aren't finishing the vaccination process and aren't going to be fully vaccinated? Or is the intention to stick with that initiated, even if people end up deciding not to finish the vaccination process and aren't fully protected?
Yeah, this is Dr. Lofkin. The plan as of now is to stick with that 60% of doses, 60% of the population that have initiated the vaccination, and not make any changes to that threshold.
And we do have a pretty good record of getting people. I mean, I know that there's 99,000 people are due for their second dose, but we've done 800 some thousand. So we have a good number actually that are coming back for their second dose. We're hitting about 70% somewhere in there on any given day that people are completing their second dose. If you go with the Johnson and Johnson vaccine, 1 and you are done.
If anyone from the media who has not yet asked a question but wants to ask one today, please feel free to raise your hand at this time. We will take a follow-up from Jacqueline. Oh, wait,
Hello.
there you go.
Hi. Question for you all on breakthrough cases and variants. I know last week Dr. Ligon said that we had at that time about 73 breakthrough cases. Do we know how much variants are a factor in this and the spread of variants in the county?
Yeah, this is Dr. Loaf again. I can attempt to answer that question. So that's a hard one to answer. We've had a very small number of breakthrough cases, and the challenge with identifying variants, of course, is whether or not those virus strains from those folks are actually being sequenced or not. So it's the long and short of it is we can't directly answer your question about the numbers of breakthrough infections that are actually associated with variants, because we don't really have that data to really answer that.
Seeing no further questions, we will move on to closing remarks. Chief Castle, Joanne, anybody have anything you would like to say before we wrap up for today?
I do not.
I just wanted to say that we are closing Cashman next week, and some of our partners are also closing their clinics due to the lack of demand. So Las Vegas Convention Center will be up and running through June. And so just to let you know that the time is now to get that vaccine. And where we're not seeing large amounts of people coming in, it's very quick. It's very easy to get your vaccine right now. So if you've been thinking about it, the time is to do it right now. Thank you.
Thank you all for joining us today. Before we wrap up, just wanted to remind you, we do have some pop-up clinics this week. Tonight we do have from 4 to 8 p.m. We're doing vaccinations over at the Hollywood Recreation Center. Tomorrow from 10 a.m. to 2, we have JC Senior Community Mobile Home Park. On Friday, our team will be out in Searchlight from 10 a.m. to 2 p.m. at the Searchlight Community Center. And on Saturday from 9 to 3, we will be at the Bob Price Community Center. Please spread the word and let's get all of Southern Nevada vaccinated. Thank you all for joining us, and we will see you next time.